And most of the time, we don't actually hear the full story. We just hear one part and then we conclude. So today we'll be talking about that. We're talking about understanding this cataract, understanding cataract, and then we'll also be talking about understanding the truth about cataract. And we're going to be debunking so many misconceptions about this cataract. Now, today I will not really be doing most of the talking. Like most of you know, I am an optometrist. I am not an ophthalmologist. So I do not carry out surgery. All I do, I take care of minor ocular diseases. I take care of eyes, every other thing except surgery. So today I have a wonderful guest with me who will be handling, talking about this, because his job, he is the one that does the surgery. So that is his job, right? So he knows more about these misconceptions than I do. Now, with me today is Dr. Elijah Chinanwa. Dr. Elijah Chinanwa is an ophthalmologist with a teaching hospital. He is a friend. He is my boss. I call him my boss. He's a friend. He is that ophthalmologist that I call anytime I have a case and he answers. And apart from that, he is a wonderful husband to my friend and an amazing father to wonderful children. So Dr. Elijah, welcome to Eyecare on radio.
Thank you very much.
Yes. All right. So, Dr. Elijah, today we're talking about misconceptions around cataract. And I don't know how much time we will have, so we're not going to be opening the phone line so that we can actually have this conversation. And then probably after that, we can see if we have more time, we can open up the phone lines. If you are listening or if you're watching on Facebook, feel free to drop your comments and your questions, and we will handle that. So, Dr. Elijah, let's talk about misconceptions surrounding cataract, right? And I know you've seen so many, you've heard so many of them, right?
Yes,
so let's talk about, there is this one that people believe that cataracts cannot be reversed, that once you have cataracts, that you are blind forever. Let's start with that misconception.
It's an absolute one, because in as much as cataract is the major contributor to the burden of blindness globally,
Okay.
it contributes like 43% to the burden of blindness in Nigeria, and then close to 51% globally.
Yeah.
So it means that if 10 people, you see 10 persons that are blind, about 5 of them was caused by cataract.
Oh.
But having established that cataract being the leading cause of blindness globally, the blindness by cataract is reversible, unlike glaucoma. Glaucoma
Yes.
is the leading cause of irreversible blindness. It means that if someone goes blind from glaucoma, you wouldn't do much to help the person. But for someone that has been blind from cataract, no matter the degree of blindness, visual acuity of less than 360 in the better eyes, towards the further blindness. If the person is being have vision of light perception, but with good projection, the person with good surgery will regain his vision. So I want to tell the populace that surgery is safe. Surgery can be done, because I've seen many people delay seeking medical intervention because of this myth that if I subject myself to surgery, is a sentence of blindness. That's an absolute false. So surgery can be done for cataract. Cataract blindness is absolutely reversible.
Yeah, that's true. Now that you've mentioned that, because that's another, actually, as recent as yesterday, I had a patient that I diagnosed of cataract, and we are doing this 50% discount and all that. So I gave this lady the referral note to go for surgery. Before me, the lady said so many things in Ibibio that I could not but none of them sounded good. All of them was sounding like, God forbid, I cannot, but of course in Ibibio. So my staff who understand Ibibio started laughing and were like, Mama, it's not like that. So the woman sees that going for cataract surgery to her is like saying go and die. That's how bad he sees her. So, Dr. Elijah, you have done cataract surgery. I think you have over almost 2 decades experience, more than that, right?
Yeah,
So you've seen this. So now, can you talk more about this cataract surgery? Why do people believe so much that once they have this surgery, they're blind?
To an extent, I wouldn't blame them.
Okay.
It says that bad news flies faster than good news. And you'll agree with me that medicine is evolving.
Yeah.
The type of cataract surgery we do today is not the type that was done 10, 20 years ago.
That's true.
Cataract surgery started with couching. Couching is when some people come to the village, they are not professionals, and they tell you there's a white spot in your eye, we can handle it, and they push it inside the eye. So most people who had their eye couched in those days, eventually some came down with endophthalmitis, with snap detachment, Avoidable syndrome, and ultimately went blind.
Yes.
Following that, we progress from couching to intracapsular cataract extraction, whereby the whole lens is removed and the person have to wear very thick glasses.
Yeah.
So when you see some old people who wear very thick glasses,
Yes.
probably they had done cataracts then.
Yeah.
It now went to extracapsular, where we do surgery and we sew. But presently, the cataract surgery done is either small incision cataract surgery or fake emulsification that can be done within 10 minutes.
Yeah.
And the person regains his vision. So the person may be afraid based on the testimony of someone who did couching 10 years ago, testimony of someone who did intracapsular cataract extraction. Today, what is done is more advanced.
Yeah.
It's the complications are fewer and the
Yeah.
outcome is near perfect. So I will encourage the person to seek for the professionals.
Yes.
There are some people that have been trained to do this surgery and the results are quite well.
That's true.
So if you are comparing with those who did then, one is bound to be afraid.
Yeah. That mentioned. Now that you mentioned about these cultures, there is another patient I had. This patient went to a popular eye clinic in Abak and did surgery in one eye, and it was fine. Now the other eye that he wanted to do, he now went and met one of these cultures, and according to him, it was a church that brought them, and they actually pushed the cataract into the eye. Now, of course, the cataract is not there, but without putting that IOL, that other lens that replaces that other one,
yes,
he's not seeing very well, right? And then he also has glaucoma, so there are lots of complications. Anyway, I sent him to you, so I hope he comes this week so that you can see him. Let's see what we can do. So now, for patients that have visited these cultures and this lens has been pushed inside, is there anything that you can do? When I mean you, I mean the ophthalmologists can do to help save the vision.
I must commend you for this program because it creates awareness both for the professionals and the laymen.
Okay.
For a church to have invited him, I wouldn't blame the church because they wouldn't know the difference between a culture and a surgeon. I believe that someone is listening to this to help us educate others.
Yeah.
You can't do cataracts in an open place. It's purely an aseptic procedure.
Yeah.
It has to be done under anesthesia to avoid pain. So when you see somebody line up and he's pushing this the eye, it's an indication that this person is a professional. Now, what are the things that can happen? I quickly mentioned them then. When that lens is pushed inside, the capsule could rupture, release lens protein, the person will have uveitis and secondary glaucoma.
Yes.
If the ongoing uveitis, the person will eventually have retinal detachments, eventually blindness, or macular edema, as the case may be. So if the person is now referred to a professional, what could be done? Yes, if the person is seen early, vitrectomy can be done to remove the lens and remove the lens in the vitreous entirely, and possibly put secondary intraocular lens, and the person will see. If the person is privileged, because most people are seen by the time they are coming, the complication has set in.
Yes.
So if someone have done surgery and you notice that you can see very far, but you can't see very near because you visited those people, it's a sign that the person is a fake. There's no lens. So something can still be done to restore the vision.
Okay, that's good to know that there is hope for those who have been unfortunate, because some people will trust the church, it's church that brought them and all that. So now let's talk about this other one that is very interesting to me. I see people, like there was a patient that came and he also had cataract, and then in having conversation with him, he said he has spent over 400,000 naira buying herbs and all these supplements online that people say cures everything. So now let's talk about that, because I don't want to ask what is NMA doing to those people. That's not the issue today, but the issue is, do you think those things work? I don't know.
What I do these days, because the supplements are everywhere.
Yeah.
And, I want to use this medium to encourage our regulatory authorities to probe further into what people are taking. What I do is, when people bring these supplements, before they take, I read the contents, and also check out the company that made them. Most of these supplements, they have their side effects, as the case may be.
Yes.
But the worst of it are those that use herbs, because some of these herbs have acidic and alkaline contents. And instead of dealing with the cataracts, might melt the cornea.
The cornea, yeah.
And with a melted cornea, the person ultimately loses his vision.
Exactly.
So I will encourage people, when it comes to this delicate organ eye, seek for the best. Look at what you just said. Someone has spent close to 400,000 naira. And I can assure you that cataract is one of the most cost-effective medical intervention, the surgery itself. That money, if well utilized, could have done his surgery and done the surgery of others. Yes. So am I saying that supplements is absolutely contraindicated? No. What I'm trying to say is that before you take in everything in this era, confirm with your health practitioner, your physician, or as the case may be, to confirm that it is healthy for your body. But as it comes to eye, healthy lifestyle might defer cataract maturity, but does not prevent cataracts. So ultimately, mature cataract is dealt with surgically.
That's good. You know, when you talk about herbs, I remember a case I shared here a couple of weeks ago. 25-year-old girl has she had bacterial conjunctivitis, something as simple as Apollo, and I don't know who advised her. She went and got one leaf. They mentioned the name in Ibibio. I don't know what it is. And they removed it. Has a whitish liquid. And then she instilled it into her eye. And imagine when you instilled the first one. According to the story eventually, because initially, they always lie. So she lied to me at the first instance. But when I kept probing, that when she instilled it, the thing sting her. She felt the pain. And when she complained, they told her that that's how to know that it's working. This lady kept instilling this fluid for ordinary Apollo. By the 4th day, she found out that everything was appearing white. The cornea, by the time she came to me, the entire cornea of both eyes are compromised. The entire cornea. So that means that for her to even regain her vision, she may end up doing cornea transplant. And we know how much that is. Yeah. So it's something that, but you see people from the part of the world, they will tell you that my grandfather did it, and I don't know. Well, that's not the point. So now let's talk about this conception, right?
What you're saying, Dr. Doris, is critical. I've been in practicing ophthalmic intervention in these states for the past 4-5 years. Okay. And I can tell you without missing word, one of the major causes of blindness in Akwa Ibom today is use of harmful traditional eye medication. That is what I've seen many people lose their vision because, they had red eye. Yeah. Someone said, use your urine, use salt and sugar solution.
Hydraulic.
Use
cow dung. Hydraulic, yes.
Cow dung. And by the time they are presenting, is complicated. You are dealing with complication, not the infection. So we want to use this medium to encourage people. In as much as we're talking about cataract, but our aim is to eradicate avoidable blindness.
Exactly.
Yes. If you have red eye, go to an expert. Don't just go to a roadside pattern medicine dealer or visit a traditionalist, because the complication may be very difficult to reverse.
Yeah, that's true. Okay, so there is this patient that won't let me to put down this question. She came with her daughter. So when I told her that she has cataract on one eye, they need to do the surgery. So she told me no, that she they're going to remove the eye, open it and wash it and put it back. I was tempted to tell her no, they will cut off your entire head and all that, because it was so funny. So Dr. Elijah, just in a simple way, because many people, when they don't know, they imagine a lot of things. No, this woman was serious, that she believed they're going to remove the entire eyeball, cut it open, remove, wash and put it back. In a very simple way, can you just give us the procedure so that in order to make people to know and stop imagining?
Yes, it's good to bring it to the fore, because almost everyone who has surgery is startled, especially those that are not enlightened. They think that you remove the eyeball, wash it and fix it back. In cataract surgery, I gave us a little historical progression from couching to intracapsular cataract extraction, extracapsular, where you do the surgery and you sew back, to small incision and phaco. Now, in small incision, you just do a little tunneling, and remove the lens, put artificial lens, and the tunnel seals back by itself. Wow. You don't even sew. Okay. In phaco emulsification, you make a little hole that's a little needle can enter. Use ultrasound, break the lens in pieces and suck it out, and put a foldable lens that replaces the lens, and the person starts seeing within 24 hours of surgery. So this is the beauty of advancements in medicine. So nobody is bringing anybody's eye to wash. And the good thing about this is that people do not know that in the course of cataract surgery, the patient is awake. You are interacting with your patient, discussing with your patient. You can discuss politics with your patient while surgery is going on. Yes. You can discuss fates with your patient while surgery is going on. It's quite interesting. So these are things to allay people's anxiety. Most times when surgery is done, I tell the patient, stand. He say, are you done just now? And I some days ago, I met a woman who told me, my only regret was that I delayed. Her case was not really cataract, it was glaucoma, because she had this myth that people say you don't do surgery for glaucoma. So for 3 years, it was back and forth. Do this surgery because, by the time she did the surgery and pressure was controlled and she kept regretting, I would have done it earlier. So if you are in a dilemma, this is coming to you now that there is solution, surgical intervention. Nobody is removing your eye.
Nobody. And that's the fear. So then let me ask this question. Can someone also do surgery in children? Children, are they...
Yes. In fact, surgery in children is more critical than in adults. For an adult eye, you have passed the stage of development. The only way eye develops, in fact, let me give an analogy. The only way muscle develops is by going to the gym. You carry weights, you develop your muscle. The only way eye develops is by seeing, vision. So when a child is born with cataracts, like congenital cataracts, it means the child has not had opportunity of seeing. And if the surgery is delayed, there's what we call a plastic period between birth to like age of 8. And you're saying I want to do at age. At that plastic period, that developmental period for vision faculties is gone. So if you are doing cataracts later, you will remove the cataracts, but you might not achieve vision. So for a child, the moment you notice there's a white speck in a baby's eye, take to the hospital. If it's in both eyes, surgery can be deferred for like a month or 2. And the surgery done and the child gets vision. Because if the surgery is not done, there's what we call stimulus deprivation. Light is not entering the retina because of the lens. So the retina is not stimulated. So just like seeing someone using one hand, the other hand has not used, gets atrophied. So when retina is not stimulated, it becomes inactivated. So what is called amblyopia. Then if the cataract is only in one eye, it's even more critical. Because what now happens is that the child begins to use the seeing eye, then suppresses the other eye, and the brain begins to record it that the eye is non-functional. So for any person that has a child with cataracts, please, as you are hearing us now, go to the nearest place you can have surgical intervention to an expert that can counsel you because of amblyopia. And having said that, I want to mention quickly, when we talk about cataracts, yes, commonly cataracts we see it as disease of the aged, but you can have congenital cataracts, and it can come from either maternal factor or fetal factor. Maternal factor, I bring it up here because preventing cataracts in an unborn child starts with when the mother is pregnant. So early antenatal is critical because the woman might have infection like rubella, toxoplasmosis, or cytomegalovirus and not know. You just say I have rashes, I have fever, not knowing that this thing might affect the baby. It may be a mother that is pregnant and works in the hospital, and he works in the place that is exposed to radiation, like X-ray. The woman should be well protected because of occupational hazard that might affect a child. We also have those that work in glass companies, like the glass blowers, exposed to infrared lights. Such women is exposed to that ray might have problem with the child having cataracts, or a woman who is abusing steroid. So these are the things that when a woman is pregnant, not just for your sake, for that unborn child not to come down, with cataracts. Then when the baby is born, are you visiting the hospital or traditional birth attendants? Because many babies have cataracts from birth trauma. How was the baby delivered? And eventually after delivery, nutrition, exclusive breastfeeding comes in, because malnutrition can accentuate the chances of a baby having cataracts. So those are the things to avoid congenital cataracts.
Thank you, Dr. Chinanwa. Thank you so much. So for everyone listening to us today, we are talking about dispelling many misconceptions that we have when it comes to cataract surgery. I know I have many patients that have cataracts, and whenever I mention surgery, the next thing is God forbid. Come on. Cataract surgery, like I said, cataract is not a blind sentence disease. No, it's not. It renders you blind temporarily until you do the surgery. And once you do the surgery, your vision comes back. Dr. Chinanwa, time is against us, so we can't even take calls today. So do you have any last words before?
Okay, I just want to, first of all, encourage you. You are doing a great job. Such a great job, because part of primary health intervention is education. So this is a part of, you are doing so much for the community, for the society, for the country. Creating this awareness. So I like anyone that have been empowered with this knowledge to go out to your church, to your community, to your friends, to your peers, and spread this information. Cataract causes reversible, not irreversible blindness. With surgical intervention, the vision can be restored. Thank you very much.
Thank you so much, Dr. Chinanwa. And I will call you again before the end of the year. Thank you so much. So you've heard it. So for those of us that like visiting people that like visiting people in their backyards and they say they're removing cataracts, please, they are called cultures and they are not professionals, and most of the time there are a lot more complications that arise from that. So I want to say thank you for listening. I know that you've heard a lot today. You can always reach out to us on 0708 4151 360. And to remind you again, we're offering free cataract screening, so you can come to Nathel's Eye Clinic for free cataract screening and 50% discount throughout this month for cataract surgery. So if you have been thinking of a way to have your cataract surgery done at a cheaper rate, this is opportunity for you to do that. Thank you for listening. My name is Dr. Doris-Optometrist. Do enjoy the rest of your weekend. Bye.
Eyecare with Dr. Doris is sponsored by Nathel's Eye Clinic, 65 Iboko Street, Uyo, Akwa Ibom State. For partnership, comments and suggestions, please call or WhatsApp 0708 415 1360.
When words are restrained, the eye